Donc, on va passer à la présentation suivante du Dr. Ibrahim ezzik, ممثل منظمة الصحة العالمية في تونس. تفضل.
السلامة، صباح الخير، good morning, bonjour، صباح المطر، جميل، صباح صحة المرأة. Okay, I'm going to speak in English, so do forgive me. My job is a bit difficult because I have to speak after Dr. Faisal and Dr. Emma, and we've covered a lot of issues, so I'm going to be very humble in my presentation, and I'm going to set the scene maybe before I start the presentation, which I think is very important. My approach is going to be through public health. I'm not going to look at cervical cancer from a disease microscope. I'm going to look at it from public health lens. And number two, I think we need to realize that we're talking about the woman. The woman is the mother, is the wife, the daughter, the grandmother, is the pillar of the society. So we really need, when we talk about a woman, we need to think of a woman as the pillar of society. Now, as Dr. Faisal mentioned, cervical cancer is the fourth most common cancer in the woman globally. Colleagues, you need to appreciate that every year there are more than 600 cases of cervical cancer infection in the world. Every year we lose more than 350,000 women to this dreadful cancer. So it is an issue, it's a problem, and we need to address it. And who is we? We is the government, is the policymaker, is the academia, the medical community, and that's why I thank from my heart Dr. Khalid and colleagues for arranging this conference, because we really need to aggressively advocate for this important issue. It should not be just a lecture and a talk and then we disappear, because the figures are clear. Dr. Faisal had illustrated so carefully that the figures are clear. So we know the facts, we know the issues. What is really left is the implementation. And throughout my career, and I've worked in 14 countries in the world, and every time I go to the field, I go to rural areas, you find a woman, and she is diagnosed with cervical cancer, and you say you need to go to the city for treatment. And the first thing she will say to you, I can't. Why? Because I have to look after my family. I don't have money for transportation. So this is the reality so when we start looking at strategies and implementation of strategies, we need to look at it from a holistic point of view. We need to look at social determinants. We need to look at the role of the woman. Data and studies are useful to help us to take decisions, but also we need to look at this from a holistic point of view. You can't hear me? Can you hear me now? Yeah, okay. I'll try to shout maybe. Can you hear me now? Okay. So what I'm really trying to say to you that one woman dies of this dreadful cancer every 2 minutes. So since we start speaking, how many women dies because of the cervical cancer? So you can see the urgency of the work that we need to do. It's not just a matter of data and presentation, but it's a matter of action and really with a sense of urgency. So I just wanted to add a few things to what Dr. Faisal and Professor Emma mentioned. What is the world doing about cervical cancer? What is the global perspective, and what's the global sort of nation is doing? And then what can be done in our region? And here, our region, some people say MENA and some people say IMRO, because we in the Arab world we always agree to disagree. So some they say Middle East and North Africa, and some say East Mediterranean region, because Algeria is part of one and Algeria is not part of one, and so on and so forth. So it is the Middle East and North Africa, almost 22 countries. So you can see that's a big part of the world. And then how should we do it? Because we know what to do, but then I'm going to suggest to you a few things of how we can move ahead with it. The good news is, for the first time, we have vaccine. Yeah, that is good news. We have the vaccine, so there is no excuse. And yes, it might be expensive, but there are ways of going about it. And we have the government alliances, Gavi, that we can work with to ensure that we have the vaccine available. And maybe we can move some of the budget we allocate for defense to buy vaccine. So there's always money to find to make sure that vaccine is available for this important issue. So what is the WHO OMS global strategy? So what we're aiming for, the overall is 4 or less than 4 per 100,000. So that's the aim, that's the goal, that's what we're working towards. And we need to have an indicator, because in public health, we carry on working without knowing what we want to achieve. So it's important to have an indicator. It's important to have a milestone that we can say, okay, we reached this milestone, we've achieved our target. So the global strategy is to accelerate the elimination of this cancer as a public health problem. As I said, as the professor said, it's not a sexual problem. We should not be labeling it as a sexual problem. It's a public health issue. And in Tunis, you say الصحة العمومية, which is the most beautiful description of public health. It is a public health issue, and it should be seen as such. So our strategy, so our strategy is to achieve 90% vaccination, 70% screening, and 90% treatment. And we emphasize that these 3 streams have to go hand in hand. And I will illustrate now with some graphs the impact, the positive impact, if we move with these 3 extremes. Each one can be effective, but they are more effective if we move the 3 of them together. So this is just to show you 3 graphs, very simple graphs, because I'm not really a statistical brains, but I just choose something very simple to show you. This, oh dear. Let's go up here. No. Maybe this one. Maybe this one. No. Go again. How do I get the graphs? Press again. Huh? Backwards again. Okay. Twice. Twice. 3 times. 4 times. Then again. Okay. And then again. Aha. Okay. So okay. Let's. So the first graph shows girls only vaccination. So look at the impact of vaccination. This is the impact. The blue line shows you the impact of vaccination. The second one shows you once lifetime screening and cancer treatment. So these people just been screened and they have the cancer treatment. And then the last one, the purple, they had the 3. So the 3 streams together. And you can see the impact of the 3 streams. So vaccination, blue, then the green one is cancer treatment and screening, and the last one, the purple one, is 3 together. And you can see the impact of moving within 3 streams together. And that's what we're really trying in WHO to emphasize. Now, okay. Now just want to look at the impact and evidence in terms of vaccination. This study was done in Sweden. I can share with you the reference if you want. The orange line is unvaccinated, and you can see the age group at the bottom. And this side here is the incidence of cervical cancer. The blue dotted line is vaccination between 17 and 30. And I think, as Dr. Faisal mentioned, if you look at the green dotted line, is vaccination above the age of 17 years. So we really need to catch this at a very early age, and it's very important. So timing is essential. Timing is very essential. Okay, so the situation in our region, I think Dr. Faisal mentioned that, so I'm not going to dwell too much about it. One of the most common female cancer in our Eastern Mediterranean region. Really, we need to remember this, affecting women in their most productive years. And that's very important. Economically, it's very important. And the incidence is 2.2 to 25, and I think it was shown by different data from both Dr. Faisal and Dr. Emma. And I think, you know, it's debatable about Tunis, whether it's 7.7, 7.2, 2.4. I think that's different studies. And of course, as I was saying to Dr. Sumaya, it depends on the data, where it came, who did the analysis. So there's always underestimation, I think, in terms of reporting. And we estimate that this incident will be doubled by 2040. So you can see that we really need to act, and we need to act yesterday, not now. So the interventions in our region, vaccination, and thus far Libya, Saudi Arabia, and UAE and Morocco, they started the vaccination program from October 2022. In terms of screening, 9 countries, and it's really sort of low participation, and really it's of most opportunistic, but not really very, it's not, as Dr. Faisal mentioned, should be mainstreamed part of primary healthcare immunization program. We need to move towards that stage, and in terms of treatment, still really we have a long way in treatment. Oncology in totality, I think, is a big challenge for the Middle East. So I think, and the health service is of course being impacted by COVID-19, so there are more complications with the health service. So the strategy is very clear. And what I want to do is I want to take one by one and shows you what the survey says and what the action we need to do on the strategy. So the first thing, that's what I mentioned, 90% vaccination, 70% screening, and 90% treatment. So the survey says vaccine hesitancy, stigma, and safety. And I mean, everybody mentioned that. It's a stigma. You know, people don't like to go because, you know, they've been labeled as sexual problem. And as I think was mentioned also, it is how we transmit information to people. Everybody have a Facebook, everybody has social media, but how often do we actually transmit and share these useful information with women? So we need to change the way that we transmit messages to the population and make sure that they reach them at the right time with accuracy. The cost of the program, I mean, each country always say, you know, well, health service is very expensive, health service is very expensive, but we need to make sure that this investment is not cost. Yes. When we use money for health, it's not cost, it is an investment, because we're going to get return on this investment in the future. The action is prevention, and we need to, of course, as I mentioned, we need to improve and accelerate HPV vaccination. In terms of the screening, we need to have infrastructure for screening. We need to look at different ways, easy way for screening. I think now, you know, a woman doesn't have to go personally for pap smear. There are different ways of doing it. There are mobile clinics. There are ways of actually reaching women. And the cost of HPV is still an issue. And I think some figures was mentioned by Dr. Emma, you know, maybe on the higher side but I think there are ways of maybe dealing with vaccination, and I think low awareness. So the action here is to increase screening and early treatment of precancerous lesions. I think that's what Dr. Faisal mentioned, and that's very important. The last one in terms of treatment, access to radiotherapy and palliative care, and that's, I think, all Arab countries really are struggling with this area. So here, strengthening the infrastructure, access for early diagnosis and treatment, and palliative care. Now, I want to bring another element here, which I think was mentioned by my colleagues, which is the health system. Health system is the key. Health system is the foundation of the work we do in public health. And our health system has been challenged by COVID-19, being challenged by emergencies in our region, you know, whether it is in Libya, whether it is in Yemen, whether it is in Syria. So all these had really impacted the health system, and the health system is struggling. And often when we speak to the Minister of Health, he says, look, the Minister of Health has so many competing priorities. Do I deal with COVID-19? Do I deal with measles? Do I deal with polio? Do I deal with cervical cancer? So they're all competing priorities, but we need to present the evidence, and we need to present it in a way that we can convince the Minister of Finance, not the Minister of Health, to make sure the allocation of budget is appropriate. And the issue of communication, advocacy, and social mobilization. These are really very important. And communication not in the old traditional orthodox communication, not a poster. The poster's time is gone. We need to have change of behavior. And change of behavior is a science to change people's behavior. And we're not talking about women. Also, I didn't mention vaccination is also for the boys, not just for the girls. I think people forget that this vaccination is also for boys, not for girls. Advocacy, we need to advocate collectively, and that's why I like this gathering, because it is academia, it's hospitals, it's the private sector, it's OMS. So all collectively, I think we need to advocate, and we need to do social mobilization. Social mobilization means we need to reach out to the communities. We need to be with the communities, working with the communities. I spent so much time in my life chasing polio viruses in Pakistan and Afghanistan, other countries. And we need to use what they used to call the street theater. You know, street theater is a drama. You actually present the message in a nice way that people can understand, not medical jargon. Because we doctors, we always use jargon to communicate, but we need to go beyond the jargon. So I want to propose that we change the word G with a C, and it's a chance now. And it's a chance really for us to move ahead with this. And we stand a good chance now to eliminate cervical cancer because we have the data, we have the evidence, we have the vaccine, we know the know-how. Women want to be vaccinated, women don't want to have the cancer. So both the supply side and the demand side, we are really there. So this is what I want to propose. We have the evidence, Dr. Faisal mentioned that. We have the tools, we have the vaccine. We have the approaches, how we actually going about it. We can use primary healthcare as an integrated system to move ahead with that. We have strategic guidance, and what is left to be done is the implementation, is the doing. And that's the weakest link in the Arab world. We talk too much, but we don't deliver that much. So we need to implement, we need to really get our hands on things and do it. And I think with this, I thank you very much for listening, and I hope that was useful.